2 recognitions. What does it mean for not only St. Luke's, but also just stroke patients in Siouxland?
So these 2 recognitions basically recognize St. Luke's as the primary stroke center, which means they have gone through the various things to make sure that patients get great care. And then the AHA guidelines, the Gold Plus Award, shows actual proof that we have done what we said we're trying to do, and that the outcomes that they're measuring we have really high compliance rates with, and people are getting good care here. The nice thing is that in the Siouxland area, both hospitals are accredited, so that patients can be rest assured that wherever they go, they're going to get great care. It's a wonderful recognition for St. Luke's team effort for stroke care.
And then also, as a stroke provider, someone who sees these patients on a daily basis, what are some things that you could tell Siouxlanders about what they can do to either prevent stroke, or if they have it, what to expect?
So there's 2 things. One is the acute symptoms are hard to recognize. Crushing substernal chest pain is easier to tell people it's a heart attack, go to the hospital. Oftentimes a stroke doesn't hurt. Sometimes headaches associated with stroke, but most of the time it doesn't hurt. And it's the loss of function. So it's the loss of feeling, it's the loss of the ability to talk normally, the loss of the ability to see right, weakness, loss of strength. So those things people more easily ignore. So if you have any symptoms that sound like stroke, I teach people act fast. A stands for arm, face, or leg numbness or weakness. C stands for trouble with coordination. T stands for trouble talking. If you have any of those symptoms, plus anything else you might think be related to the neurological system, get to the closest emergency room right away. Call 911. Because time lost is brain loss, and there is something we can do. We have a clot-busting drug, TPA, that can be given to help people recover from stroke. And it's only given in a certain time window, so the longer you wait, the less chance you have of getting it, and the more brain tissue dies. So that's what I would say to anyone is don't wait, don't try to figure out if it's your carpal tunnel. I'd rather have you get to the emergency room and get treated. As far as stroke prevention goes, I think the main thing is it used to be that everyone went to their doctor and just did whatever the doctor told them to do, and that paternalistic side of medicine is changing. And you really need to be an advocate for yourself and your health. So when you get your numbers checked, your cholesterol checked, know what your numbers are. Don't accept it's okay. Find out what they should be, and then you need to know what they are. And what medicines do you need to take to help get those numbers where they need to be. So no matter what happens, you need to control your diabetes, blood sugar, cholesterol, don't smoke. If you have an irregular heartbeat, you sometimes need a different medicine to control that as a stroke risk factor. So all of this stuff it's changing the focus and the ownership of taking care of yourself to you, and you got to know your numbers and work with your doctor to get those taken care of and get them where they need to be.